Welcome to this educational video about anomalous right coronary artery from the pulmonary artery, also known as ARCAPA. This rare heart condition involves the right coronary artery originating from the pulmonary artery instead of the aorta. Join us as we delve into the details of this condition, exploring its causes, effects, diagnosis, and treatment. The exact cause of ARCAPA is unknown, but it's believed to be a congenital anomaly, meaning it's present at birth. It occurs during the early stages of fetal development, when the heart and its major vessels are forming. A developmental error leads to the right coronary artery connecting to the pulmonary artery instead of its usual origin, the aorta. Normally, the aorta delivers oxygen-rich blood to the coronary arteries, which then supply the heart muscle itself. In ARCAPA, the right coronary artery originating from the pulmonary artery carries oxygen-poor blood from the pulmonary artery. This can lead to a coronary steal phenomenon. Because the pressure in the pulmonary artery is lower than in the aorta, blood may flow backwards from the coronary artery towards the pulmonary artery, depriving the heart muscle, particularly the right ventricle, of the oxygen it needs. Over time, this can cause ischemia or reduced blood flow and even heart muscle damage. ARCAPA is a rare condition, estimated to occur in approximately 0.02% of live births. It is often diagnosed in infancy or early childhood, although milder cases may go undetected until adulthood. There's no known specific genetic predisposition or risk factor that definitively increases the likelihood of ARCAPA. The signs and symptoms of ARCAPA can vary depending on the severity of the condition. Infants may present with symptoms such as failure to thrive, poor feeding, irritability, and rapid breathing. Older children and adults may experience chest pain, shortness of breath, fatigue, palpitations, or even sudden cardiac arrest. In some cases, individuals with ARCAPA may be asymptomatic, with the condition only being discovered during routine check-ups or evaluations for other heart conditions. Diagnosis of ARCAPA typically involves a combination of non-invasive and invasive tests. An electrocardiogram or ECG may show signs of ischemia or heart muscle damage. An echocardiogram, which uses ultrasound to visualize the heart, can sometimes reveal the anomalous origin of the coronary artery. However, the gold standard for diagnosis is often a coronary angiogram or a CT angiogram. These imaging techniques use contrast dye to visualize the coronary arteries and confirm their origin and course. While ARCAPA isn't usually classified into different types, the severity of symptoms and the degree of blood flow compromise can vary considerably from patient to patient. Some individuals might have a small anomalous connection and good collateral circulation, leading to minimal symptoms, while others might have a large, hemodynamically significant anomaly, resulting in severe symptoms and potential for life-threatening complications. Treatment for ARCAPA typically involves surgical correction to restore normal blood flow to the heart. The surgical approach depends on the patient's age, the size and location of the anomalous artery, and the presence of other heart conditions. Common surgical techniques include reimplantation of the right coronary artery to the aorta, ligation of the anomalous artery at its origin from the pulmonary artery with or without a bypass graft to the right coronary artery, or creating a tunnel from the aorta to the right coronary artery. Medical management, including medications to improve heart function and prevent blood clots, may be used as a bridge to surgery or in cases where surgery is not immediately feasible. Because ARCAPA is a congenital condition, there's no known way to prevent it. Prenatal care and a healthy pregnancy are important for overall fetal development, but they won't necessarily prevent the occurrence of ARCAPA. Early detection and intervention are crucial for improving outcomes. The prognosis for individuals with ARCAPA depends on the age at diagnosis, the severity of the condition, and the effectiveness of treatment. Untreated ARCAPA can lead to significant heart damage, heart failure, and even sudden cardiac death, particularly in infancy. Surgical correction generally provides excellent long-term outcomes, with most patients experiencing significant improvement in symptoms and a reduced risk of complications. Recent research focuses on refining surgical techniques, improving diagnostic accuracy with advanced imaging, and better understanding the long-term consequences of ARCAPA repair.